Alright, so now let's talk about the mechanisms that cause damage. So we should see this, we should see initiation of the damage, how the damage starts, progression of the damage, how it develops, and then complications of the damage, what happens, once it becomes unstable. So let's start. First of all, I'm going to discuss two primary factors that would cause the damage: hypertension and lipids, or hypercholesterol or hyperlipidemias. There are other factors that can cause damage to the endothelium. For example, there are infections that can cause damage, and there are so many other factors. So let's start with the hypertension first of all. Look, the endothelial cells, so this is a blood vessel, and these cells here are the endothelial cells, and the blood passing through the vessel is in a laminar flow. So this is like the blood is caressing the cells on the way out. So it's kind of touching them and saying, hey, nice cell, how are you doing? So it is going through that laminar flow. Cells really love the laminar flow. Do you know this? That if you caress a cell, if you kind of, love a cell and you touch it, what does that cell do? The cell's cytoskeleton makes sure that the nucleus receives the signal to open up the gene for SOD, superoxide dismutase, which kills radical oxygen species or reactive oxygen species, ROS. So the cells that are exposed to the laminar blood flow have increased levels of superoxide dismutases. They are protected from oxygen species. They are protected from atherosclerosis. This mechanism is called anti-atherosclerotic mechanism or atheroprotective mechanism. Now, it is funny. So we have one more cell. So let's take this cell here, and that cell is enjoying increased SOD. Here we put the same cell, and now this cell is sitting in a turbulent flow. Blood is coming and sloshing and running fast, and it is hitting this cell. The cell is like going all over the places. Oh, the blood is coming, RBC hit me. What happens to this cell? The cytoskeleton is all mushy and running, and is stretched and shrunk and sheared. The shearing effect of this turbulence causes the superoxide dismutase gene to somehow close. So think about it, what's going to happen now? SOD is not present, reactive oxygen species are going to start becoming active. They would cause damage. They would damage the cell membranes, they are going to start damaging the proteins, and soon the cell is going to become damaged. What will cell do? When there are increased reactive oxygen species, it tries to protect itself from that, and it would start becoming active and trying to create cytokines. Inflammation will start. So please remember, in hypertension, one primary mechanism of starting the endothelial injury, people just say, well, the turbulent flow causes the endothelial injury. Yes, that is correct. How does it cause the endothelial injury? This is the mechanism. Alright, so that is one mechanism. Another mechanism with the lipids, LDL levels. LDL, the low life DL. HDL, high flying guy. HDL is a good cholesterol, LDL is a bad cholesterol. Why is that? HDL takes the cholesterol from the cells, it sucks them up and takes them back to the liver and gives it to the liver to take care of it. LDL takes it from the liver and says, oh, I'm going to bring a gift to the cells and give it to them. So is this a bad thing that there is cholesterol being brought to the cells? Not really. We make hormones with the cholesterol, so it's not entirely a bad thing. Cholesterol is part of the cell membranes, and it creates the fluidity of the cell membrane. If our membranes were not fluid, we will not be elastic like this and stretchy and nice like this. So the cholesterol has its function. But when there is more LDL than wanted, when there is more LDL than needed, and chronically more, please remember I said chronically more LDL, then what happens? Let's see that progression over here. What happens in that case is the LDL, so here is a LDL with the ApoB100 protein sitting on its outside. You know that what is the center of the LDL made up of? I hope that you know. If I make a quick structure of the chylomicron, it is a, instead of a bilayer for the phospholipids, it's a single layer for the phospholipids, and in the center sit the cholesterol esters and triglycerides and all those things, right? So that is what is the chylomicron, and then chylomicron has a set of handles on it which are generally made like this, but these are really proteins that are present all around this thing, and these are the proteins with which various cells can handle the chylomicron and work with it. So here we have LDL. LDL has ApoB100, and LDL receptors are present in the liver and are present on the cells. So chronically increased level of LDL ultimately causes LDL to start accumulating under the endothelium. So if you see here, I've put some phases. This is a blood vessel here. This is the lumen of the blood vessel. I have opened up the walls of the blood vessel, and we are looking at, this is the endothelium, this is the intima, media and adventitia. This is the internal elastic membrane. So all the action is in the intima. Atherosclerosis is a disease of the intima. So we're going to see how this happens. We already know that if the patient was hypertensive, then we know what would happen. The shearing effect of the cells will reduce their superoxide dismutase. That would give a chance to the reactive oxygen species to cause damage, and the injury would start. So this is the column of injury. Now how would the LDL cause the injury? It would come down inside. When it comes inside, in the tunica intima, there are reactive oxygen species present here. What happens is this LDL becomes oxidized. So injury initiation has the reactive oxygen species working, or oxygen working with the LDL in the intima to create oxidized LDL. Done? Now, what is the problem with that? Look, the oxidized LDL has another problem. It would trigger, you will see that soon as we go, it would trigger more reactive oxygen species. It would trigger more ROS. Why? Because it would cause the macrophages to become active. Macrophages would release more reactive oxygen species. That would cause, so here is an interesting thing, that reactive oxygen species, increased levels, will cause, see the nitric oxide, we talked about it in our previous lectures. Nitric oxide is released from the endothelial cells. So if I make an endothelial cell over here, the cell releases nitric oxide. This nitric oxide works on the smooth muscles and relaxes them. This is a smooth muscle. The nitric oxide works on them, and we have done the pathway that how does this relax them. It relaxes the smooth muscle. That would mean that the vessel diameter would increase, vessel will be relaxed. Now tell me, if there is not enough nitric oxide, the smooth muscle relaxation would reduce. That means vasoconstriction, reduced diameter. How would that happen? Reactive oxygen species, when they act on the nitric oxide, they increase the decaying of the nitric oxide. So LDL came in, it increased the local reactive oxygen species. The result was that nitric oxide has reduced. That would cause vasoconstriction. So come here for a second. Increase reactive oxygen species, reduce nitric oxide, vasoconstriction because of increased cholesterol, hyperlipidemias. Then what? The same effect as the hypertension. Why? Why did we go back here? Why is this shearing happening now? Look guys, we have reduced the vessel diameter from here to here. The blood flow, the blood pressure has increased, right? Turbulence has appeared.